CDC estimates that 1 in 3 women in the United States will have a hysterectomy before the age of 60. And here to tell us more about hysterectomies and the very cool technology that you've brought along with you is Dr. Myron Luthringer. Good morning.
Morning.
So you're telling us that there are 3 different types of hysterectomies. Is that correct?
Right. Hysterectomies can be performed first the old-fashioned way through a open abdominal incision, 6 to 8 inches long, and that leads for long hospitalization and recovery for the patient. And then there's what we term minimally invasive hysterectomies, which are done with the Vinci robotic hysterectomy or conventional laparoscopic hysterectomy or vaginal hysterectomy. So the big shift in trend has been to try and promote the minimally invasive procedures because it's so much better for the patient.
Yeah, quicker recovery time, I would imagine.
Well, definitely lower complications, lower infection and bleeding, markedly reduced pain for the patients too, and that leads to a shorter hospitalization and also, a quicker return to their normal activity.
Yeah.
I see my patients having a Da Vinci hysterectomy, about 1/3 of them go home the same day as the procedure. The other 2/3, go home the following morning, where when we used to perform the open hysterectomies, those patients would be in the hospital 3 to 5 days and have a 6 to 8 week recuperation period. Now the patients are back to work in a week.
Wow.
Dr. Luthringer, the CDC has these new guidelines, and this is where the Da Vinci comes in, correct?
Right. Well, some of the new statements have been put out by the American Association of Gynecologic Laparoscopists, which is one of our governing bodies, has said that when a hysterectomy is going to be done, it should be done minimally invasively. It's the procedure of choice. And what we're finding is that if a surgeon isn't skilled or have the training in these procedures, the recommendations and the mandates are that they either seek help from a trained colleague or refer that patient to somebody that can offer that procedure to the patient.
Do you find that some of your patients are a little bit hesitant or wary to kind of have a robot operating them rather than the doctor's actual hands?
Definitely not, because the surgeon is in total control.
You're still doing the work.
Total control. It's amazing because the way I move my hands and my feet is exactly how the instrument moves within the patient.
So let's talk about the instrument. This is a 3rd generation device. You were on the show a couple of years ago, I think, with the 2nd generation, right?
Correct.
Now, every hospital in the area, Community General, Upstate, Medical University, Krause, and St. Joe's has one, right?
Yes.
So why is this better than the second one? What's the improvement?
Well, there's improvement. It's 3-dimensional.
Okay.
So that helps any type of surgery. The instruments are still wristed versus conventional laparoscopic instruments that don't bend. So these will bend just how I would want to use my hands inside.
There's like 4 arms here. It looks like that device from what is it? Thinking of Arnold Schwarzenegger. Terminator. So why so many arms? Walk us through it.
Well, you have one arm that's a camera arm.
Okay.
And then there's 3 other arms that you can utilize to move organs around, to cut tissue, and to...
So basically everything you can do with your hands, you can do with this machine.
I can actually do better with the machine because the wristed instruments actually can bend at a more of degrees than I can my own wrist.
Wow. Dr. Luthringer, could you give us a demonstration?
I can let you give us a demonstration.
Okay.
So, Kayla, come on over and sit down.
And you were saying that now with the new, you can do this 3 dots for the hysterectomy as opposed to a 6 to 8 inch long incision.
Right.
Okay.
Couple small 1 centimeter incisions. So you're going to look in the console.
Okay.
These are the master controllers, so fingers.
Wow. Do I put my feet on the pedals?
No, you
here?
don't have to touch the pedals on this one. We won't give you that lesson today. And just start to move around.
And I'll get over here, doctor, so we can see
and try to pick up one of those bands and put it up on. Oops.
Okay. There's a malpractice lawsuit right there.
That's right. Yeah.
Okay.
Yeah. One of the interesting things while you're playing there is.
And this is how it looks from the.
From in the console.
Yeah, from in the console. Okay.
I think I locked it.
Okay. Let's see.
I think it knows I'm not a trusted doctor here.
Now, what's different about this, doctor, is that this can do basically it could do mock surgeries, which the other device can. And talk more about that for training.
This has a simulator, which helps for training. This model actually also has a separate console. So if I'm training a surgeon or a resident, just like where you training for
an Air Force pilot or
driving,
whatever.
driver's ed. I can lock out what they can use and what they can do, and I can take control of the instruments.
So what do you do? What I want to ask you really quick, we're nearly out of time. What do you do with the other one? Is it go on Craigslist?
No, it's still being utilized.
It's still being
utilized.
Okay. So. Well, you're offering a free information event for anybody. It's free to the public. It's informational session Wednesday, the 27th of April, 5 o'clock, Community General Hospital, free and open to the public, 492-5180 if you want to register. Doctor, thank you so much.
Dr.
We appreciate
Luthringer,
it.
thank you so much. That was such a pleasure. That was very cool.